I actually began here in early 2017 and coming from both Connecticut as well as Rhode Island in the past. And I've been involved with graduate medical education for about 10 years or so, having various roles over that time. I originally was a faculty member out of a chief residency in Chicago, and then a core faculty member after that, associate program director, and then eventually residency program director. Along the way, I've also had an opportunity to be involved with the administrative side of things, namely being a clinic director as well as a medical director for another facility in Rhode Island. So my primary love generally is working with residents and students. That's what I love to do. I'm a primary care general internist by training. However, the thing which gets me excited in the morning and puts a smile on my face throughout the day is working with the residents and medical students. United Health Services has its own mission and vision. And what I've done today is actually bring a copy of that because I want to make sure that our potential residents and students too understand what that is. And just for the purposes of this, I want to go ahead and read that. So the mission for United Health Services is to improve the health of those we serve through our commitment to excellence in all that we do, and to be the region's leading integrated healthcare system, demonstrate exceptional value, and deliver coordinated patient-centered care. So that is our mission as well as our vision for United Health Services in general. And I think that all the residency programs, internal medicine, transitional, and preliminary year included, support that to a T. That being said, one of the very first things I did when I came here was try to translate that and distill it down into a similar mission and vision for the residency program. And again, I'm speaking mostly about internal medicine here, and I'll share that with you as well. So that is to provide evidence-based didactics and pragmatic patient-centered training across diverse inpatient, outpatient, acute, and longitudinal care settings so that our graduates qualify for and successfully pass the certification exam and subsequently perform superiorly in primary care, hospitalist medicine, or fellowships as desired. Now that I know is a mouthful, but every single word in that statement was crafted for a specific reason. Based upon that program level mission and vision, what we have done is, as a program, is to try to structure our overall goals and objectives, our curricula, our schedules, block schedules, call schedules, and so forth, and all of our didactics, and generally our curricula in general, has been customized and designed just to support that mission and vision. And I think we've succeeded. There are several different methods that we are using to try to target and improve on that mission and vision on an operational level. And that's something that we consider to be in partnership with our current residents as well as our administrative staff and the hospital staff as well, to try to tailor it to the institution, at the institutional level I should say, as well as at the program level. So for the transitional year residency program, again, there are a minimum set of standards that any transitional year program has to meet. For us, what we try to do is tailor that to the specific requests and desires of those candidates. We consider them to be equals and peers to our internal medicine, our family medicine, our preliminary year candidates. But again, we recognize that they've got a very unique situation that requires both the understanding of their background as well as what their next step is going to be. And as a result of that, we need to try to prepare them as best as possible for their subsequent residency program, be it radiology, anesthesiology, or whatever they're going into. So again, at the beginning of the year, we tell all of our transitional residents that there's a minimum set of expectations that they're going to have, a core set of rotations that they're going to go through, the internal medicine wards, the ICUs, and so forth, and that will all be per requirements. Beyond that, we say, okay, well, what do you want to do? Where is your next step in your career going to take you? And as a result of that, we look at their schedule and basically try to design that such that they can have the best possible education experience while they're here to prepare them for the next step in their training. Now that translates into a customized block schedule for them. That also translates into a customized conference schedule, a didactic schedule for them that is fully tailored to meet and exceed their needs.